The medication in healthcare settings. Describe the medication aide's role. The healthcare system is made up of providers, facilities, and patients. It's constantly changing. In recent years, healthcare facilities have relied more on unlicensed healthcare workers. These workers are trained to perform specific tasks under the supervision of licensed healthcare professionals like nurses or doctors. EKG technicians, phlebotomists, patient care technicians, and nursing assistants are all part of this growing area of healthcare systems. Medication aides are part of the trend as well. They are usually employed in long-term care facilities or assisted living facilities. Some states may also allow medication aides to work in group homes for people with intellectual disabilities or in prisons. Usually medication aides have been trained to work as nursing assistants first, then they receive additional training to give medications to residents. Each state has different rules about how medication aides are trained. States also set different rules about the tasks these aides can perform. Common tasks MAs perform include the following: preparing ordered medications and distributing them to residents under supervision of licensed healthcare professionals, usually a nurse; observing residents as they take medications, helping as needed; documenting or keeping a careful record of the medication residents take, including the time and amount of medication; observing and reporting changes in residents, especially those that could be related to effects of medication; reporting to a nurse or other licensed professional anything that might be a risk to resident safety, such as resident refusing a medication or a mistake in giving a medication. Depending on the state and facility, the MA may also have similar duties to those of nursing assistants, such as assisting residents with activities of daily living, measuring and recording vital signs, observing and reporting changes in residents' conditions or abilities. Most states also share certain rules about what medication aides cannot do. These rules are meant to promote safety. Tasks that MAs do not perform include the following: giving medication to a resident whose medical condition is changing or unstable, deciding when to give a PRN medication or medications that are given only when resident needs them. PRN is an abbreviation of the Latin phrase that means as needed. Giving medication by injection, deciding what amount of medication or dose to give a resident, or doing calculations to find the correct dose. Medication aides have many different titles, including the following: medication aide or medication assistant, certified medication aide or certified medication assistant, medication aide, certified or medication assistant, certified medication technician, or certified medication technician. The title given varies by state or facility requirements. The textbook will use the term medication aide. Discuss the professionalism and list examples of professional behavior. Professional means having to do with work or a job. Personal refers to life outside of a job, such as family, friends, and home life. Professionalism is behaving properly when on the job. It includes dressing appropriately and speaking well. It also includes being on time, completing tasks, and reporting to the nurse. For medication aide, professionalism means performing the tasks exactly as assigned, making careful observations, documenting carefully, and reporting accurately. Residents, co-workers, and supervisors respect employees who behave professionally. Professionalism helps people keep their jobs and may also help earn promotions and raises. A professional relationship with residents include providing person-centered care or care that is sensitive to each resident's particular needs, keeping a positive attitude, doing only assigned tasks that the MA is trained to do, keeping all resident information private or confidential, always being polite and cheerful, not discussing personal problems with residents or their family members, not using personal phones in resident rooms or any resident care area, not using profanity even if a resident does, listening to the resident, calling a resident Mr., Mrs., Miss, and Miss, and using the person's last name or by the name they prefer. Terms such as sweetie, honey, dearie, etc. are disrespectful and should not be used. Using pronouns the resident prefers: she, her, he, him, they, them. Never giving or accepting gifts.